Hello and welcome. This is Victoria Bolville, and I'm with Dr. Vera Reinstein. We are with Alliance Health, and we are presenting a training on some shared decision-making tools that Alliance has developed as part of our health literacy campaign. Alliance has a strong commitment to improving whole person care and has created a health literacy work group that is currently developing tools and partnering with multiple media outlets to increase member participation in guiding their own health care. This training is to talk about our recent collaboration with various medical institutions and some tools that have recently been developed which can be used by prescribers and our members. Our health literacy and engagement work group began researching decision-making aids related to medications, and we were very fortunate to be able to collaborate with the Mayo Clinic. We've based our card format for the shared decision-making tools on a format that the Mayo Clinic has been having a lot of success with. We were also able to partner with the Mayo Clinic around content for the depression cards, and we reached out and collaborated with Alameda County Behavioral Health for the antipsychotic cards. We worked with internal and external psychiatrists for content for our anxiety card, and for our ADHD card, we were able to partner with Cincinnati Children's Hospital. The purpose of the cards is to support collaborative and meaningful discussions about the risks and benefits of prescribed medications when members are making choices about their health care. For more information about the benefits of the shared decision-making process and examples of how individual card decks can be used, please join us in watching the following short videos. The first two are from the Mayo Clinic, and we start with a clip from Dr. Victor Montori.
Shared decision making is the process by which a patient and a clinician work together, have a conversation, partner with each other to identify the best course of action, the best treatment, the best test to do at this point in time. It involves sharing information. The clinician will share information about the alternatives and their relative pros and cons. The patient may want to share information about their prior experience with treatments, information about their own values, their own preferences, their own goals and expectations. May also have information that they may have gathered by talking to friends and family, by doing their own research, looking up things on the web. And when patient and clinician come together to share that information, the hope is that they'll be clear about what are the things that begin to matter to the patient. And then there'll be a process of deliberation, of consideration of the alternatives. And very much over time, the best course of action will be arrived at by consensus, by agreement between the two parties. That's what shared decision making is. Making it happen in reality is tougher than imagining this simple but important or vital conversation. Making it happen in reality means that the clinician has to be prepared with that information, be able to share it with the patient in ways that the patient can understand and engage with. They'll have to have the time to do it. They'll have to have the quiet in the office to do it. They should not be interrupted. They should be able to be ready to have those conversations. The patient, on the other hand, also has to be ready to understand, to participate, to bring forward their concerns, to share those with the clinician. So both the patient and the clinician are actively involved in shared decision making. It's not a passive process. To make that happen, we are producing tools that help the clinician convey that information to the patient, again, in ways that are engaging, that are practical, that communicate effectively and accurately what is it that we know and we do not know about the alternatives in the patient's situation. We have developed several of these tools that we make available on our website. These tools are freely available. Patients of our patient advisory group help us develop these tools along with colleagues, and so we make those available freely for people to download and use. But they're not to be used by the patient alone at home. They are to be used with the partner, with the clinical partner, with the clinician, physician, and involved nurse. There are tools to create conversations. We expect those conversations to be meaningful, to be relevant to both the patient and the clinician, and to give them a confidence at the end when they reach the decision, that the decision that they've reached really reflects not only the best available research evidence, but also the values and preferences of this particular patient. We have ways of measuring that has happened, but the fundamental measure that we have done a good job in terms of shared decision making is that patients walk away feeling that they know enough about the options, that knowing that the option that was taken up was probably the best given the circumstances, and that they are willing and ready to act on that option and to stick to it over time, to learn of the effects that that option will have on themselves. Our group is particularly interested in doing this work in patients with chronic conditions, which gives us an interesting opportunity because as patients go in their journey, they may learn more about themselves, about the treatments, about how the treatments react on themselves, and calibrate those decisions over time, refining them and making them better. For that purpose, they need an able and willing partner in their clinician. At the end of the day, we think that through shared decision making, we're bringing about a real patient revolution by which patients' needs and wants are at the center of our clinical activity.
So, Mr. Jones, after the discussion we've had about, why you're feeling the way you feel and how we can help you, one of the ways that we talked about was through a medicine for this condition, this depression condition. And some things to remember about these medicines that applies to all of them is that perhaps the most important thing is that most people with depression will find a medicine that will work, that will make them feel better. But it may not be the first try around. 6 out of 10 people actually will get it the first try, but 4 out of 10 will need to try others until they get the right one for them. We'll be together through that journey. We may get it right the first time. It may take a few tries. Now, you'll need to take the medicine for a period of time until you start feeling better. And it takes about 6 weeks to get the full effect of the medicine. So it's not one of these things that you take a couple tablets and you know if it's going to work or not. You may start to feel better fairly quick, but it will take about 6 weeks until you get the full effect of the medicine. And some people, given that this is your first episode of depression, may need to take it up to 6 months or longer. So this is a medicine you'll be on for a while. Most people get at least one side effect from these medicines. The side effect may or may not be important, but if it is an important side effect, most of them go away after you stop the medicine. Okay. All right? So those are in general the kinds of things that we want to review with you. All the options I'm presenting here to you, for the most part, work to the same extent in making you feel better if they're going to work for you. So the issue then becomes choosing across a range of potential downsides of these medicines. So which aspect of the medicines would you like to discuss first?
I think sleep is the most important.
Very good. So let's take a look at that. And your problem is too much sleep or too little?
Well, I have nightmares because of the depression.
And does that mean that you're having difficulty falling asleep because of
Yes.
you're afraid of those nightmares?
Yeah.
Okay. Well, 2 of these medicines are actually particularly good at helping you get to sleep. And so perhaps we should learn more about those 2.
Mm-hmm.
The other ones have no effect either to make that symptom better or worse. So which aspect of those medicines would you like to discuss next?
Well, let's look at weight change.
All right. So you can see this one can make you gain quite a bit of weight. That's a Remeron, can make you gain quite a bit of weight. The amitriptyline or triptyline have a little bit less of an effect on weight.
Okay. So it looks like maybe this one is the one we need to maybe look at.
Yeah. So a couple of things about that medicine is that it's available in generic. It's prescription drug. It's available in generic. It's about $4 a month in the supermarket. So I think that's a good deal. And then a couple other issues is that they may have an effect on reducing your sexual desire. But if that were to happen, we can decide together if that's an important issue enough
It
for you.
looks like both of them would have somewhat of a side effect on it.
That's right. So that doesn't distinguish the 2 of them, but the one that you've chosen may have that, so we just have to pay attention to that possibility. And then finally, this is a medicine like most of these antidepressants where we don't recommend that you just quit right away, but if we had to do that, to change to another one because maybe it's not working or otherwise, this is one that is associated with least problems if you were to need to do that sort of thing. So it sounds like it's the right one to choose. In terms of side effects, the one that we haven't talked about, the main consideration is that it may cause some gastrointestinal problems, as you can see here. But again, those the way we deal with those is if you were to get them, we have to then decide together if they're worth considering changing the medicine for it. But otherwise, they don't have any other major issues associated with that. So is that an okay choice for now?
Sounds like the right choice to me.
Okay, well, let's start there and we can review. To help review this, I'm going to share with you the same issue as the cards, just put in this format here. So you can take this home, and if this doesn't work out, you can look yourself here and we can have another conversation. Perhaps we can change the medicine, but now we will be talking sort of on the same page.
Sure, sure.
Okay, so we'll go ahead and give you that prescription, and we'll follow up with you in the next couple of weeks.
For our shared decision-making tools, we put together 4 cards and 4 card decks, and we have them packaged in pairs. Our first pair is anxiety on one side for easy use, and on the back, if you flip it over, is ADHD. You can see you can fan them out and select whatever topic is best for your conversations. The second deck that we have are antipsychotics on one side. You see they fan out, just the same. And on the back, we have depression. So as you're using the cards, just remember which side you're on, and you can see at the bottom, each card references the topic at hand.
There are common themes between all the card sets. All the cards have the information on what you should know and things to remember. In a couple of the card sets, specifically the anxiety and antipsychotics, this is actually combined into one card. Stopping approach is in the ADHD, anxiety, and depression card set. And all of the cards discuss side effects. And in some cases, the side effects are specific to the individual drug class being discussed. So there may be different side effects between the different card sets. All of the card sets have a companion guide with suggested talking points and tips, sort of like behind the scenes information, or more specific information than what's displayed in the cards, specifically for provider staff to consider as they're talking with individuals about these meds or issues. This is an example of what you should know card and a things to remember card. And the companion guide lists some important information to talk about in addition to what's on the card. And please note, as you saw in the previous video, that the bottom of the cards are labeled for each of the diagnoses, just to make sure you don't turn the cards over and mix them up. And each of the cards have information pertaining to each of the medications. And this is an example of the weight change card that's part of the depression card set. And the companion guide has information that is very helpful to address with the patient when discussing weight issues, such as eating a healthy diet and getting enough exercise are also important, etc. Another common theme among the cards are the stopping approach, which is in the ADHD, anxiety, and depression cards. And while you can see the frowny face for the medications that typically require tapering, and this is for the ADHD meds, the companion guide has some additional information that would be helpful for especially non-providers, non-physician providers when covering this information. Another common theme that is present in the anxiety and ADHD card sets include the risks of misuse. And as you can see in the ADHD set, they are scored with the non-stimulants having a much lower risk. And the companion guide has further talking points, again, that can be helpful in having that conversation. The companion guide as well as PDFs of the shared decision-making card sets are all available at the Alliance website. You may also contact Lori Cavanis over at Alliance to get your hard copy and especially to provide feedback, as we do intend to update this card set. Thank you very much for your time and attention, and we hope you find these cards a valuable asset in your practice. Thank you.